My name is Gina del Peso. Antibacterial envelope to prevent cardiac implantable infection. Definition. Despite the use of various antibiotic prophylaxis regimens and advocacy of access surgical practices, suicide cases statement infections placement of CIS remains a major complication and are associated with substantial morbidity, mortality, and healthcare utilization. Video.
Heart devices like pacemakers and defibrillators are great at correcting heart rhythm problems, but they're not without risk. Now, a new technology aims to make surgery for these devices safer. Every year, more than 1 million people worldwide receive an implantable heart device like a pacemaker or defibrillator. These complex gadgets can be life-saving for some, but surgery to implant or upgrade them comes with a risk of infection.
Infection is not something you can treat with antibiotics alone. It's the consequences of the infection that makes us really feel very concerned about it when it happens.
A bad infection can lead to invasive surgeries, long hospital stays, and even death. Typically, doctors give patients antibiotics before the procedure to prevent infection. But now, this antibiotic envelope can also be used during surgery. It's made of an absorbable mesh that wraps around the device and stabilizes it. In a study of almost 7,000 patients, infection rates dropped by 40% when the antibiotic envelope was used.
To prove that there's an additional intervention, additional therapy that you can provide as a preventive measure and was able to cut down the risk by 40% is something really remarkable.
The envelope is coated with 2 antibiotics, minocycline and rifampin, which are continually released over several days. It fully dissolves in the body after about 9 weeks. A simple innovation that gives patients peace of mind when they need heart surgery. Infections occur in about 1 to 4% of cardiac device implantations. And that's your Health Watch. I'm Connie Fellman, Local 5 News.
Application in nursing. Research to patients through fluid T application rounds. Taking vital signs, blood pressure, and heart adequate, and distribute the reproducers want with a possible displacement of the electrode. Taking a temperature in which infection vindicated bed of infection. Current altered electrocardiogram. Administration of antibiotic prophylaxis. Video.
An antibiotic wrapper can prevent pacemaker infections.
The doctor is in. It's On Call with Dr. Howard Smith.
Wrapping a new pacemaker in an absorbable antibiotic-soaked mesh before implantation can prevent a nasty infection later. Cardiologists at Cleveland Clinic conducted and recently published the results of an international multi-center study of the FDA-approved Medtronic Trix absorbable antibacterial envelope. The trial enrolled nearly 7,000 patients in 25 countries, each receiving a pacemaker or a defibrillator. Half of the subjects received the antibiotic wrapper in addition to the standard prophylactic oral antibiotics. The mesh wrapper is constructed to release the 2 antibiotics, minocycline and rifampin, over a week, reduce the incidence of infection by some 40%. This included not only pocket infections occurring around the devices, but also the incidence of endocarditis, a nasty infection of the heart's internal linings. If you or someone you know are a candidate for an implantable pacemaker or defibrillator, ask your cardiologist about gift wrapping your device in the Medtronic Trikes. That's health news you should use. Thanks for listening, and special thanks to my followers on social media. I'll be off next week, but I will place some best of episodes on the feed. Until we next speak, I'm Dr. Howard Smith, reminding you to keep a smile on your face, your brain active, and your body in motion. These are the best medicines.
Pros. Intravenous administration of sulfasulfate before the procedure reduces the risk of infection by 81%. Cans. The added infection is a rarer but serious event and management requires prolonged hospitalizations with involves device and delete extractions with indicated antibiotic to repair. 18 to risk of major complication with extraction is low approximately 1 to 2%, batteries can't be filtered. The complementary of an antibacterial research in a significant lower incidence of serious infections of cardiac implantable electronic devices compared to standard prevention strategies without conscious aid reader at caring of complication. Video.
Number 7. Antibiotic envelope for cardiac implantable device infection prevention.
Pacemakers and defibrillators are life-saving electrical marvels, but do not come without risk. Infections occur in 1 to 4% of cardiac device implantations and can lead to a 25% one-year mortality rate. Treatment costs average around $60,000. Until now, giving the right antibiotics right before the procedure was the best and only proven way to prevent infection. Despite this, infections continue to occur. The recent innovation of an implantable antibiotic envelope ensures delivery of 2 antimicrobial drugs locally in the pocket for 7 days after implantation surgery. The week-long release of the drugs minimizes the risk of infection. The absorbable envelope received FDA clearance in 2013, but healthcare professionals were awaiting results from the landmark worldwide randomized rapid trial. The findings, published in March, show a 40% reduction in major infections, making cardiac implantable device procedures safer for patients.
Conclusion. In conclusion, agentivic use of an antibacterial envelope resulted in a 40% lower incidence of major CIED infection than standard of care infection. Prevention strategies, how low Patients who received and envelope did not have more procedure related or symptom related complications than who did not receive it. Thank you.